symptoms which are associated with venous insufficiency or the discomfort caused or the symptoms caused by venous disease are the following. I've noticed that probably one of the strongest indicators that one has venous disease is night cramps. And I would have, if you asked me that 20 years ago, I would have never, that wouldn't be the first thing which would come to my mind. But a lot of patients with venous disease, with venous insufficiency, get night cramps. And when I treat these patients, the first thing which seems to go away is a night cramp. Now the other symptoms, of course, are the heavy, tired feeling. You know, we all get tired at the end of the day, the leg hurts. We think it's just normal. Not necessarily. You don't have to hurt in your legs just because you're above a certain age. Sometimes it is caused by venous insufficiency. And one of the ways of finding out, if you put your leg up, pain goes away, the chances are you do have venous insufficiency. If you wear compression stockings and the discomfort goes away, the chances are very good that you have venous insufficiency. If you have burning or heavy, tired feeling, burning sensation where your varicose veins or your spiders are, or you feel a little bulge where you're hurting, the chances are, again, your problem is caused by venous insufficiency. Hyperpigmentation. Hyperpigmentation, hyper means increased level of pigment. Patients who have dark coloration of the lower leg, what happens is the pressure inside the veins are so high that red cells literally ooze out of the vein. And when the red cells gets outside the vein into the tissue, it's like a fish out of water. The red cells die. And what gives the red cells their color, what hemoglobin gets its color from, is iron. So when the hemoglobin molecules break down, you get iron deposit in the lower legs, and the skin looks very dark. If you're pouring iron into the skin, into the tissue of your leg, lower leg, it causes scarring. So the skin is not only dark in coloration, but also thickened, like leathery appearance. Most people, when I mention that, they say, "Doc, I remember my mom had it, my grandmother had it, my uncle had it, but I'm glad I don't have it because I just have varicose veins." And my argument is, the chances are that your mom, your grandma, your uncle, when they were your age, all they had was varicose veins. Now that they're older, the condition has become chronic, and now they are in the shape that they are. So it is very much advisable to, I believe, know if you have venous insufficiency, and if you have venous insufficiency, try to take care of it earlier than later. Another condition which I was actually surprised to see happen so commonly in patients with venous insufficiency is restless leg syndrome. In one study I read almost 10 years ago, they had found that 75% of patients with restless leg syndrome and venous insufficiency, when they had their venous insufficiency treated, the restless leg syndrome went away. And 75% cure or improvement is very significant. It is more than a lot. So if you have restless leg syndrome, think about venous insufficiency. Another symptom of venous insufficiency is leg swelling. Now, there are all kinds of reasons for leg swelling: too much salt, heart failure, kidney failure, pregnancy, etc., etc. But the swelling that one gets associated with venous disease is usually what we call non-petting edema. And don't worry about the terminology. Basically what it means, if you put your finger and push on your ankles and you leave indentation, that's a petting edema. The chances are that's not related to venous disease. But if you cause non-petting edema, then it is most likely related to venous insufficiency.